Welcome to the American Heart Association's Pediatric Advanced Life Support course. The focus of PALS is early recognition and management of respiratory and circulatory emergencies. For the child already in cardiac arrest, PALS interventions must include the essential core skills of basic life support. Advanced care is only effective when added to high-quality basic life support. Without good BLS, advanced procedures are unlikely to be helpful. This PALS course has been updated with the latest evidence-based science to equip you with the information you need to evaluate, identify, and intervene for a child at risk of respiratory and cardiac arrest. First, you will evaluate an infant or child to determine the child's condition. You will use a systematic approach that includes an initial impression, primary and secondary assessments, and diagnostic tests. You will also develop high-quality CPR techniques and effective team dynamics. The PALS course emphasizes the importance of identifying and treating respiratory distress, respiratory failure, and shock before progression to cardiac arrest. Early identification and treatment are crucial to saving the lives of seriously ill or injured children. Studies have shown that when cardiac arrest does occur, high-quality CPR is more important to survival than drug administration. As a reminder, the components of high-quality CPR are initiation of CPR within 10 seconds, compressions of adequate rate, compressions of adequate depth, full chest recoil after each compression, minimal interruptions in compressions, give breaths that make the chest rise, and avoid excessive ventilation. Because high-quality CPR with minimal interruptions in chest compressions is fundamental and should never be compromised, all PALS students are expected to perform high-quality CPR throughout the course, not just in the specific section where CPR is reviewed, practiced, and tested. You must be able to recognize respiratory failure and shock and intervene quickly to prevent cardiac arrest in children. This requires cognitive knowledge and psychomotor and communication skills. Cognitive knowledge that you will review in this course includes recognition and management of respiratory and circulatory emergencies, identification and treatment of rhythm disturbances, medication administration, and an understanding of PALS algorithms and flowcharts. Psychomotor skills that you will practice in this course include high-quality CPR, electrical therapy, airway management, intraosseous access, fluid and medication delivery, and team dynamics including effective communication and leadership. The PALS course strongly emphasizes the importance of effective teamwork and communication among team members. You will practice the roles of each team member and will act as a team leader during core case scenarios. To get the most out of the PALS course, you will actively participate in the practice sessions and complete the skills and learning stations in the course. You will participate in skill stations for CPR and AED, management of respiratory emergencies, rhythm disturbances and electrical therapy, vascular access. You will participate in learning stations where you will practice working as a team and using a systematic approach to evaluate, identify, and intervene for a variety of critically ill or injured children. These stations include cardiac arrest and rhythm disturbance cases, respiratory cases, shock cases. You will also be tested on your BLS skills. This test will include 1 and 2 rescuer infant CPR and 1 and 2 rescuer child CPR with the use of an AED. You will then be required to pass a written test with a minimum score of 84%, as well as perform effectively as a team leader for 2 core case testing stations, including 1 cardiac arrest or rhythm disturbance case and 1 respiratory or shock case. In a moment, you will receive an overview of the science supporting the PALS guidelines. But first, your instructor will take a moment to pause the video and answer any questions you may have.